Hey everyone, Dr. David Atwood from Marin Peak Physio here.
Adrian Carvalho from Marin Peak Physio.
We're here for our next video on our mini series for low back health, so follow on for the next video. All right, the exercise that we are going to work on here is the half kneeling hip flexor stretch. This is one of the most important stretches that we can do. For most of us, you have jobs sitting, you travel, those hip flexors are going to tighten up. That's going to create a lot of extra stress on that low back. So we're going to get into the position here. So Adrian's already in the half kneeling position. Wonderful model. And so these are the muscles right here. Move your arm here. These are the muscles right here. Yeah, you can point them out for us. Right around the area of the pocket. I always tell people the pocket is exactly where those hip flexors mostly are. So that's where we're going to try to focus in on this stretch. All right, so what we're going to do here in this position is we want to create what we call a posterior pelvic tilt. So what Adrian's going to do is he's going to engage his core muscles. He's going to engage his glute muscles here. And by doing that, we're going to tilt your pelvis backwards a little bit. When you're doing this properly and you're doing this correctly, if you're wearing a belt, that belt should lift up and forward. When you get into this position, you should be feeling that nice stretch on the front of your hip flexor in that pocket area down into your quad. Little bonus footage for you here. We're going to give you 2 advancements that you can also do if you're finding that that base level hip flexor stretch is not quite enough for you. So let's get back into that correct position. Core is engaged, glutes engaged. We get that nice posterior pelvic tilt. Perfect. The next step that you could take if you need a little extra stretch on this right arm, you're going to reach it up, overhead, into the air. That's step 1 to give you a little bit of that extra stretch there. All right, so Adrian, next he's going to bring that arm down. This is what is called a couch stretch. So it's a little bit more advanced. It's going to be a bit more challenging. So what Adrian is going to do is he's going to bring his back foot up onto this. Call this a couch stretch because it's basically like if you were doing this on a couch at home and then you're popping up into that same position. What is key here is making sure that you are maintaining that good pelvic position that we talked about earlier. Remember that posterior pelvic tilt? If you're finding that you're having to arch your back or lean too far forward here, then this is a bit too advanced for you right now. And we're borderline there with Adrian, but he's being a good model for us either way. All right, we're going to finish up this video with a couple of things that we should try to avoid. So one of the first things that I want to point out here is if you are finding that you are getting into this half kneeling hip flexor position and you find that your body is going way forward this way, we actually don't like that. So that tends to be a little bit more of an aggressive stretch on the joint. And in this specific instance, we're searching for a lot more of that hip flexor muscle. That's what we're trying to target here. So if you're finding that you're having to lean way too far forward, take a step back, try to focus on that pelvic tilt that we talked about. Number 2, the big challenge that can happen is if you find that you are arching your back way too much, you're getting into this extra curve, we call that lordosis. If you're finding that you're getting heavily into that extra curve, that could actually be placing extra stress on your low back, which is exactly what we're trying to avoid here. Thank you all for following along with another educational video here at Marin Peak Physio. Hit that subscribe button if you'd like to see more of our content that's coming into your feeds regularly. Also, please give us a comment if you have a question about that specific exercise or if there's something you'd like us to cover in the future. See you next time.